Said it would be very loud. Good afternoon, everybody. I'm Lori Yoakum. I'm the Director of Care at the library. We are excited to have a second community chat this month. I have Miranda Fickenpaw and Journal Flea Hardy from Cozad Community Health Systems here to talk today about a very important thing, which is Medicare sign-up, which opened on Wednesday. But you probably need some information before you sign up. So, ladies, thank you for coming today.
Medicare Advantage differs from Medicare in that it is primarily treated as a traditional insurance company, like your Blue Cross, United Healthcare, where Medicare truly is a federally funded program through the government.
It's supposed to be just like a traditional Medicare plan. However, we're finding that that doesn't really seem to be the case. Even though they're supposed to follow the same rules and regulations, we find additional barriers to care that are put in place, and patients are finding surprises that they didn't expect.
They may offer lower out-of-pocket costs for premiums. Much of the time, the cost sharing is different. The pre-authorization requirements are much more stringent and they're higher. They will deny care that would be approved under traditional Medicare guidelines.
The financial side of it may look beneficial, but the services that are covered or authed or allowed are much different. And they're usually taken aback or caught off guard from that because they do not have an understanding of what the significant differences are. And so then when they have an ER visit and then they get admitted to the hospital and they realize this isn't covered and now I have to pay for all of it, or only covered as an outpatient or an observation versus an inpatient stay, it can be somewhat a defining moment for them because they don't have the resources at home to take care of them, and they don't qualify to be in the hospital or a nursing home. And so then their family's like, what do we do with this? And it causes some pretty significant distress.
Another struggle we see with Medicare Advantage is delays in necessary care. So it's very frustrating for our physicians and their patients when they order a test or procedure and they have to wait up to 15 days to receive determination on whether or not they can have that service, whether it's an MRI, a CT scan, approvals for physical therapy. It's all a big challenge to try to get the care they need in a timely manner.
Medicare Advantage truly is having a huge impact in our community and hospital, merely because of the campaigns that they show. And they're really pushing Medicare patients to sign up for Medicare Advantage, saying it's lower cost. The benefits are just the same as Medicare. The impact to the hospital is truly providing a financial burden for us.
More and more over time, I think we're going to see, certainly it's occurring nationally and now starting to be seen regionally, is that many providers and facilities are no longer accepting Medicare Advantage plans. People in our community that do have a Medicare Advantage plan are going to have limited choices in terms of specialty services and providers that they can see in the future.
My advice would be to research both options, make sure you understand them, and research from independent sources. The United States Office of Inspector General has a detailed report on Medicare Advantage and some of the issues with it, but my personal advice would be seek traditional Medicare. You'll be able to be seen wherever you want to be seen with traditional Medicare.
I love rural healthcare because the impact you're going to make on people's lives is far larger than any tertiary facility will ever be. When the same doctors that you see in the clinic, in the emergency room, in the hospital, are the same ones that are at the baseball games and the football games and the grocery store and at church, the accountability to make an impact is so incredible, and the opportunity to change lives is much higher.
Healthcare is one of the key cogs in a rural local economy. It's very important to support agriculture, small businesses, and helps to recruit and retain people of all ages in our community.
I think that the lives in rural America is just as important as the lives in urban America, and we need to make sure that they have good access to high quality care.
I'm Lori Masnick, and I believe that strong rural health makes a strong rural Nebraska.
Okay, so with that, in your handouts, this first handout on the front, it talks about our monthly coffee chats. First of all, just a little plug for our health system that we are providing monthly talks the third Thursday of the month at 9:30 at the Grand Generation Center. I did one on advanced directives. This month, I think, was fall preventions. I'm not sure what we're gearing up for the next month, but stay tuned and please join us if you can. Cinnamon rolls provided for the first 12 attendees. So, and then on the next page here, we'll go ahead and start talking about the Medicare basics. So obviously Medicare is available for anyone age 65 and older, or a person that has a qualifying disability 2 years or more are eligible for Medicare. You've been paying into Medicare through all your workforce history. What Medicare is, it's a federal health insurance plan for those of you that qualify. Medicaid is another term that you hear. Medicaid is separate. That is assistance through our state that's based on your income and assets. So what we're talking about today is Medicare. Miranda and I have decided to start these talks about a year ago because open enrollment starts October 15th and goes till to December 7th. And we just wanted to get information out there for those of you that are utilizing Medicare health plans, Medicare Advantage health plans, to educate you on how things are looking, how things are changing, and so that you can make the best choice for your health care. Where the resources are, Miranda and I are definitely here to help you navigate the system, make the best choices for yourselves. Also, the Nebraska Area Agency on Aging has a SHIP person that's on staff that can also help navigate you signing up for your Medicare plan.
On the next handout is just gonna go over the different parts of Medicare. So your Medicare Part A is like your hospital stays, so your inpatient stays, any like skilled services, that's also referred to as sometimes swing bed, and then also your hospice services. Your Part B is gonna be covered like your doctor's visits, your specialty visits, your durable medical equipment, if you would need a walker, oxygen, etc. Skipping down there a little bit, that Part D is your prescription drug coverage. Okay, so the Part C is a Medicare Advantage plan. So that's where A, B, and D are all combined together to make that Part C. So with that Part C, you're gonna have a traditional card and then you're gonna have an Advantage card, but you will not need prescription drug coverage because that's already covered under that Part C. With that Part C, you also get that Advantage plan, you also get dental insurance benefits and vision benefits as well. Traditional Medicare does not offer those services. You would have to pay for those separately.
And just to chime in on that a little bit, so Part A is free once you turn 65. Part B, there's a $185 premium per month that will come out of your Social Security if you've accepted your Social Security at 65, or you'll have to pay a premium separate from that until you do start getting your Social Security. The other thing I wanted to mention too, with that Part C was we're starting to see them have premiums now separate from that 185. When they first came out, they said Part C is free. It's never been free. You've always paid that 185 for your Part B to get C. That's not ever changed. But now we're starting to see some premiums with Part C.
In addition to the 185?
Mm-hmm. Yeah.
And then it's not on the PowerPoint slide, but on the handouts, there's also the phone numbers there.
Yeah, the phone numbers are on there. So like when you sign up for Part A, you're gonna call Social Security. Whereas when you're gonna change any of your Medicare plans, like your script plans and things, you'll call the Medicare number.
I have a question. Do you have to sign up for Medicare every year?
No, you should not really. If you do traditional Medicare A and B, you don't
You should
ever
just
have-
sign up once?
Yep.
But if you want to change, let's say you have Medicare Advantage, you got talked into it last year,
Mhm.
and you want to change,
This is the opportunity.
this is the opportunity to change.
And with that, if you were on a Medicare Advantage plan, so you were on traditional Medicare, you switched to an Advantage plan, and it's not working for you and you want to switch back to traditional Medicare, usually you have a year to do that. But with that, you also want to get a supplementary insurance as well. And if you had a supplementary insurance before and you switched to the Advantage plan, you should not have supplementary insurance with an Advantage plan. So more than likely you got rid of your supplementary insurance. It's very hard to get back on a supplementary insurance. You're gonna have to go through health screenings.
Your premiums could be higher.
But your premiums could be way higher. You know, these supplementaries, they're gonna say, oh, you know, she needs this insurance. We might be able to bump it up a little bit, so. And you're not always guaranteed supplementary insurance either if you switch back to traditional.
Why would you need a supplementary insurance? Can you give me an example?
Sure, so if you're in the hospital, you come in for IV antibiotics, you're there for 4 days, you're probably what's called an inpatient status if you're on traditional Medicare. With that, you're gonna, Medicare is going to cover everything except $1,632. That's as of 2025. That does go up next year. So then you are responsible for that $1,632 unless you have a supplementary insurance. Your supplementary insurance will then cover that deductible. So, and if you don't have that supplementary, then it will be patient responsibility then.
Yeah, you're probably always gonna have some out-of-pocket expenses with Medicare, and so your supplement will pick that up. Like she said, but like for example, swing bed. If you were to come here for swing bed services, you have 1 through 20 days at 100%. But if you needed 6 weeks of IV antibiotics or something in our hospital, then Medicare pays everything but $205 a day, and so then your supplement would pick up that $205 per day. So,
Or if you didn't have a supplement, you would be
You would pay the
responsible for that
$205
$205. Okay.
So when you purchase the supplemental insurance, how do you link that to the Medicare?
Medicare actually assumes that. So like when you come into, I guess I should clarify your exact question.
Okay, my question is, you know, there's United Healthcare, Mutual Omaha, Humana, all these. When I pick one, how do I make sure that is linked to Medicare as my supplemental insurance?
So when you come into our hospital through the admissions process, they're gonna take scans of your copies of your insurance cards, and then we'll bill Medicare first, and then Medicare or ourselves notify that supplemental, and then they submit the rest of your bill to that Plan G. The communication will take place through our business office or through the Medicare system. Because your agent will probably have put something in a system, a database that shows that you have a Plan G. Because I know, like, we've had people come in and ask us at the end of our talks to see what they actually have. They show us 6 or 8 cards. So Miranda can call our business office and say, hey, can you check what journal Flea Hardy has? Give her my date of birth and my social security number, and then they can pull up and see what I have in that system. So there's a network that's talking on the back.
So when I sign up, when I choose one, I'll get a separate card.
Yes,
for that.
you'll get a Plan G card.
Plan G is the best plan out there.
It's the best plan.
And also, prescription D plan, there's a lot of choices there too.
There are a lot of choices, and what I would recommend is talking to your pharmacist.
Yep, I am.
And see what
And
best.
that'll be a separate card too.
Correct, yes.
Gotcha.
And that's why the Advantage is kind of enticing. It's one card. It's one stop shop. It's kind of like your Walmart. It has your A, B,
I
your
want the
D.
standard.
Yeah.
Yeah.
And that's the thing that we're here to educate, is just because Advantage has changed enough over this brief time that it's been in existence that we have a lot of facilities around that are not accepting it. A lot of physicians, clinics are not accepting it. And so it's just really hard for the rural person to navigate their healthcare when they want to stay local, but maybe their facilities are not accepting it.
So are the premiums deducted out from your social security, or do you pay that directly out of your pocket?
For Medicare, that can come out of your social security.
What about the supplement?
And the Plan D could probably come out of your social security. The supplement would probably come out of your checking and savings account, or you
Okay.
write a check every month. Yeah.
Okay.
Great questions.
Yeah, okay. So I would just always ensure that if you come into our hospital, clinic, wherever you may go, always have a copy of your cards. Because if we didn't have a copy of your, say, Mutual of Omaha, then we're going to assume that you don't have a secondary insurance. If you don't notify us, then we're not gonna go looking for that.
Right.
So we're gonna send you a bill, and then you're gonna come back and say, well, I have this Mutual of Omaha, why didn't it cover it? Well, we may not have had that information.
Okay.
So just always make sure and have your cards whenever you go to.
Right.
Anywhere.
If you're from North Platte not taking any advantage.
That's true. So if you would show up to, the ER there in North Platte and you have a Medicare Advantage plan, they have to see you. They will see you. But just know that you're not going to be in network. So you're going to pay an out-of-network, deductible.
And I didn't bring my sheet up here with me, did you grab one of those?
I did not.
So on the sheet that says Medicare Advantage, that, white one that's stapled together,
Uh-huh.
on that first, this one right here. Do you get one of those? Yeah, okay. So this one here, if you look down about 3 paragraphs into it, it talks about, the average out-of-pocket in-network and out-of-pocket out-of-network. So where North Platte will be out-of-network because they don't accept your Advantage plan. We saw in 2024, based on statistics and reports, that there was an average of $13,000 out-of-network cost
Wow.
to that person that had that Advantage.
And that wasn't covered.
That was not covered.
That's your out-of-network deductible that patient is responsible
So to
for.
sign up for Medicare, now you can do that online, correct?
Yes. Online, call the number here, the social security number that's up here.
Do you have to call that number?
Well, so that they know that, because 3 months before you turn 65, they actually should be sending you some information from Medicare about the process, the online, who to call, and when to do that.
Because I just signed up online for Social Security and then it was gonna take me to Medicare.
Okay.
And I didn't sign up yet because I can't sign up until, well, our conversation earlier was December 1, because I'm still on a group plan.
Right.
So.
Okay, yep. But did you when you signed up for Social Security, did you let them know that you wanted to keep your, insurance through work till?
Yeah, there was a place where you could type in a comment,
Okay,
and I did that.
okay. Because you want to make sure that they know you're covered, so you have no penalties for not taking the.
Right, so I was covered through a year.
Okay.
Yeah.
Did you have any other questions about your?
No.
Okay.
So actually, I do.
Yeah.
So just what this gentleman was saying, so if you are still working,
Mhm.
right, but you want to sign up for Social Security, you need to make sure that you're letting Social Security know that you still have insurance with your
Your
job.
place of employment or your
Yeah.
husband's place of employment, yes.
Yeah, okay.
And with that, your work insurance will be your primary insurance. If you were to get like Medicare later, your Medicare is always going to be secondary. Yeah, work insurance would be primary. And you would only get like that Part A, Medicare. You won't get that Part B until you have stopped work. You no longer have insurance like through your employer.
But take your A, because because you don't want any penalties later.
Well, I was gonna say, can you talk about what does that mean? Penalties and,
So they have come up with penalties if you don't sign up for your insurance.
this is Social Security has come up with penalties?
That's a
This is
very good
Medicare
question.
has come up with penalties?
I'm assuming it's more Medicare because your premiums are higher. That's where it factors in, is they add, what we say the other day. Our husband's was like,
Yep, a
3 years
yearly fee.
of like $3 a month was added to his premium. And then this year went up to $6 a month or something. So they keep just adding additional, cost, like late fees, kind of, but it was, yeah. It's a
Oh,
penalty.
because he hadn't said that he already had a primary.
Right. But if you have a primary healthcare through your employment or your husband's employment, and they know that, then your transition should be pretty smooth. But you still want to be in contact with them because you don't want to take off of the insurance with your spouse and then not have this one ready to go in time, because they have to, obviously they need to get paid. So they want to have that, figure out how your premium's going to get paid so that you can restart.
Yeah, so for an example, my husband is older than I am, and he's on my insurance. So when he hits 65
Mhm.
and wants to sign up for this, he would need to say that he's on my
Yes, yep.
insurance.
And then your insurance would be his primary still, and then his Medicare would be that secondary.
And he probably doesn't have to take the B out, but he should take the A out. Yeah. There's no reason not to take the A, it's free. So it's just a nice benefit.
Yeah.
Great questions, I love it.
So I'm gonna just kind of break down, traditional Medicare versus Medicare Advantage, just with some of the services and, the differences between them. So, traditional Medicare, you need to go see a doctor, in Kansas. And, traditional Medicare, you can usually go wherever, anywhere is going to take traditional Medicare. As far as Medicare Advantage, you know, North Platte's not taking Medicare Advantage plans. I know Lexington, they only take, a few Medicare Advantage plans. Us at Cozad Hospital, we take all of the Medicare Advantage plans currently except Aetna Medicare Advantage. So if you know anybody that has Aetna Medicare Advantage, please get a hold of us, because if you were to come into our hospital, it's going to be an out-of-network deductible that you are going to be responsible
What's
for.
the best, if you were to go with Advantage programs, which ones of those are the best to go, that pay the best and do the best for the hospitals in?
Yeah,
Well, first you want to find out from your hospital which ones they accept and which ones they do not accept. And same with your specialty doctors, your oncologists, your urologists, your cardiologists, all those things.
Because I know some don't pay as good as others.
so there's, WellCare, there's United Healthcare Medicare Advantage, there's a Humana Medicare Advantage, which we don't typically see, a lot in our area. There's a Blue Cross Blue Shield Medicare Advantage. I don't know if I said WellCare or not.
Yeah.
So they all have, you know, if that's the route that you decide to choose as Medicare Advantage, I would definitely look at each of the individual plans. I can tell you at Cozad Hospital, it seems like, we are able to contact, like representatives from Blue Cross Blue Shield a little bit easier. So if you would come into our hospital and they're denying a service, it seems like I have pretty good luck with getting a hold of a representative, you know, to advocate for you. You know, if a service was denied, again, I have that representative that I can, you know, call and talk to. It's not me calling the 1-800 number and hopefully getting, you know, somebody that I can talk to, so.
So to answer that, Blue Cross Blue Shield Medicare Advantage is the better one for
On
us.
that, and they talked me into going to the DSNP and to the WellCare DSNP
Okay,
and stuff, so.
who's they? The perfect person you talked to on the phone that tried to get you signed up for?
Well, because they said if you want to go to Nebraska, to North Platte, that was the only one the doctors would accept, is what they were saying.
So North Platte is not accepting any Medicare
Yeah.
Advantage plans.
But they were saying they would accept at that time the WellCare DSNP. There's another deal in between.
Sure.
But, so I ended up going with that, but I feel like we're having to jump through hoops a lot more than I did on
And
the
that's kind of what we're seeing in
Blue Cross
general.
Blue Shield that I'd had.
And we feel like their benefits are changing. We're kind of jumping ahead a little bit, but with this conversation, they're changing even some of their benefits, like their spendable cards and stuff, those little perk cards. They went from $200 some a month now down to $75 a month. And I just feel like that's gonna keep continuing to trend. Like, I think it's an enticement, and then I think it's just kind of, you're gonna see those perks going away a little bit.
Yeah, I'm sure.
Which is unfortunate, because some of our, you know, community members have Advantage and they've had it for more than 1 year, so they really can't go back to traditional Medicare with a plan G that's affordable. And they're kind of stuck, and that really stinks. So, and that's why we want to just get that education out there, so you can find that.
So if you're on the Advantage plan for very long, then you can't even go back to,
You can, you'll just be responsible for all the out-of-pocket expenses, because you probably will not be eligible for a Plan G that's affordable.
And the Plan G, just as a reminder, is the
The
supplemental.
supplemental, yep, separate from Medicare on that, yep.
But you can, change Advantage plans during this open enrollment time. So if you're not happy with that WellCare right now, there's always a possibility you could get back on, you know, Blue Cross, United Healthcare, whichever plan you would choose.
my eye specialist is in North Platte. And that's the only plan they would take.
Okay.
And I see an eye doctor here sometimes, but I've had problems with my eyes. And he says he didn't even look in my eyes. He had me do the machines and stuff, but then he never even looked in my eyes to double check anything and he said everything's okay, even though I was complaining that I was having a lot more blurriness and my eyes were bugging me a lot and stuff. So I'm not sure that I'm really satisfied with that. It seems to have finally calmed down a little, but it's been months that I dealt with that before it finally calmed down.
Yeah.
I don't know what the problem is, and I still get a lot of problems with my kind of like matter in my eyes. You know, they all say it's just dry eyes, but
Let's chat after this and see if maybe we can find, you know, see if they take any other plans or, you know, your eye specialist, maybe we
yeah,
can give them a
because
call.
I really wanted to go back, but I was afraid to.
Yeah.
To ask, because I really felt like, I've got a twin sister, and she was diagnosed with an eye disease that's, from, what do you call it, that's in your neck, it's in your neck.
Thyroid?
Thyroid eye disease. And you need to be taking something early on to keep it from getting worse. And I wondered if part of my problem was that, but
Yeah.
I've never been diagnosed with it. Nobody's even suggested it.
Okay, so going back to here, so, specialists, so, traditional Medicare, usually you don't need a referral to go see, you know, a urologist, stuff like that. Some specialists, they are requiring, prior authorization, or again, they don't accept Medicare Advantage plans. Access to care when traveling, so again, you know, like a Blue Cross Blue Shield Medicare Advantage plan may only be, you know, a Nebraska plan. It may not be if you would go to Florida, you're gonna still pay that out-of-network deductible, where if you had that traditional Medicare, it's gonna be across the border.
Does it make a difference whether it's PPO or the other one?
PPO is, without a referral, and HMO is with a referral, if I remember correctly.
Okay, I always have the PPO is what I always.
Hospital stay limits. So with traditional Medicare, say that you have a urinary tract infection and you need IV antibiotics for 7 days. With traditional Medicare, you're going to more than likely stay in our hospital for those 7 days because our provider has deemed it medically necessary for those IV antibiotics. And we're gonna work with your provider, the care team and everything, you know, to assure that you're safe whenever you go home. With the Medicare Advantage plans, you, again, could need those IV antibiotics. So once you come into our hospital, we're going to send a notification to your insurance company saying that, you're in our hospital, again, you have the UTI, maybe had a fall, maybe had some confusion, and you're needing those IV antibiotics for 7 days. They could look at that and they could say, well, we'll give them 4 days in the hospital. Well, we need the antibiotics for 7 days. So then it's us, you know, kind of scrambling, you know, trying to come up with another plan with your care provider. What are we gonna do for those other 3 days of IV antibiotics that you need? So labs, x-rays, diagnostic services, kind of the same thing. Say that you go into your primary care doctor and, you fell and your knee is just bothering you and he's recommending a CT scan. With traditional Medicare, you can go, the provider is going to send over an order to our prior authorization team. They're going to make sure it's medically necessary and then, get it sent off to our scheduling department. There's no authorizations for traditional Medicare as long as the doctor deems it medically necessary. Now, of course, there's certain stipulations, like a mammo is every year, like a low dose CT scan, there's certain requirements for those, but otherwise there's no authorization. For these Medicare Advantage plans, again, that doctor's gonna send over that order saying that you need this CT scan done. With that, we're gonna submit it to your insurance. And I know up there it says 3 days. We're not finding 3 days. We're finding about 15 days. So we're gonna wait 15 days for your insurance to determine if it's approved or if it's denied. Let's say that it's denied. They may deny it because they may say that you need 6 weeks of physical therapy before they're going to approve for you to have this CT scan done. Or they may say, you have to do a home exercise program. You have to have this, this, and this before we're going to deem it medically necessary. Now with that, if they say that you need physical therapy services prior to the CT done, well, we also have to get an authorization for those physical therapy services. So that could be another drawn out process. We're going to submit that authorization for you to have physical therapy. And we're going to pray that they approve for you to have those physical therapy services. Now they may say you need to have 10 visits before you're gonna have this CT scan done. Well, they can come back and say, but we're only gonna approve you for 4 visits, okay? It's just kind of all a delayed process and authorization wise. Home health and medical equipment. So you come into our hospital, again, you have those IV antibiotics for 7 days, but you could still use some therapy or some, you're now going to be on oral antibiotics. You need that home health care after you discharge home. So usually Janelle and myself, the providers, we've already probably talked with you about which home health agency you'd like to choose. So again, we're going to submit that to the home health agency. With traditional Medicare, no authorization is required. Again, as long as the provider deems it medically necessary. With these Advantage plans, you're going to wait again, because they have to submit it to your insurance, make sure that they approve it, that it's medically necessary for them to come out and see you. You may get discharged from our hospital on a Thursday, but with that, for home health services with your Advantage plan, they may not get to come to you till the following Tuesday or Wednesday. It all depends when your insurance decides to approve it. Same with durable medical equipment. Your doctor may say that it's medically necessary for you to go home on oxygen or for you to go home with a walker. Again, traditional Medicare, as long as the doctor says it's medically necessary, you're going to get the necessary equipment that you need. With these Advantage plans, they get to determine if you really need that walker, if you really need that oxygen. And again, that oxygen, it may be it's very important that you have the oxygen if you need it, but they get to determine if you meet their qualifications. And with that, you're also going to pay a $35 deductible every month, copay, a $35 copay in order for you to have that oxygen with the Medicare Advantage plan. You're not gonna pay $35 a month with traditional Medicare. You need it, it's yours. And then physical therapy, occupational therapy, and speech therapy. With that, again, traditional Medicare, as long as the provider deems it medically necessary, you're gonna continue to work with that physical therapist, occupational therapist, speech therapist, until you, the therapist, the provider, feel that you have met all your goals. Again, Advantage plans, you're gonna come in for that initial visit. The therapist is going to eval you. We're gonna take all those CPT codes that they need to work with you on, and we're going to send that out to insurance. Again, then you're going to sit and wait at home until your insurance approves you to come back for your next physical therapy appointment. And again, they could approve 4 days. After those 4 days, we have to submit it back to your insurance, and we have to, again, wait for you to get more additional visits, okay?
And that's the Medicare resources we just added on the back there. They're also on the magnets at the back of the room too, that have Miranda and I's information, contact information, as well as Vicki, who's our SHIP representative with the Nebraska Area Agency on Aging.
Is the big difference, so Medicare Advantage is A and B plus vision and dental?
So Medicare Advantage is your A, your B, your D, all combined together to make a Part C.
Okay.
Plus dental, vision.
Plus dental and vision, okay.
Yep.
And right now, if I heard you correctly, they are moving toward, cost, the word has escaped me,
Like a premium.
a premium,
Yes.
yeah.
Yep.
But A is free,
Yes,
is B,
B's $185 a month.
B is $185 a month.
And you're gonna
And you're
pay
going to
that
need,
if you're on traditional Medicare or if you're on Medicare Advantage, you're going to pay that on either plan, that $185.
that $185,
It will be
okay,
deducted out of your
so,
Social Security.
so the Medicare Advantage is at least $185, if not more.
Yeah.
So A is free, B is $185, you're going to need a supplemental
And
unless you want to pay for things yourself. And then if you wanted dental and vision, you would need to pay for
yeah,
that
you can
too.
also do this as well.
I just wanted to make sure I had those correct in my.
No, you're right.
They're right on, yep.
So here's just a free event. I actually watched it probably a couple months ago. So if you just, type in this My Senior Health, or you could type in this, address here. It's just kind of understanding the basics of Medicare again. So it's a free event, and they're just kind of breaking it down. What's Part A, what's Part B, kind of like we did here today. They talk about Medicare Advantage a little bit, but then also you can always reach out to them if you have additional questions as well.
Sorry, that's not included in your handout.
Yeah,
It's
okay.
hard to write
Yeah,
down.
I already figured
Yeah,
that.
sorry.
Yeah. And I can.
Does that,
for you after.
Does that address really start with a capital Y, or is it supposed to be just HTTPS?
That's a good question.
I would assume probably just HTTPS, but yes, I can definitely double check that. If you just type in, go to Google, and if you type in this My Senior Health Plan, up at the very top, they have like education, or it says webinars, and then it will take you to this webinar, the Understanding the Basics one. So,
And that's coming up October
October 23rd.
23rd.
Yep, at,
12
like the lunch
o'clock?
hours, so.
Yeah, Central Time.
Yeah, just another good resource to try to understand.
Yeah, it says 10 a.m. down below, but up there it does say Central Standard Time is 12 to 1, so yeah, you can make sure you get on at the right time.
We kind of already talked about, PT, OT, and ST. Just another thing to be aware of. You're not gonna have a copay with traditional Medicare, but with Medicare Advantage plans, that they may approve you those 4 visits. But you're gonna pay $30. I think it's actually $35 now. You're gonna pay $35 a copay per visit. So if they do approve you 10 visits for physical therapy, you're also going to have to pay $350 for those therapy services. So. And then I wanted to talk about swing bed services. So say that you live here in Cozad and unfortunately you fall, you break your hip. You're probably more than likely gonna come into Cozad Hospital here via ambulance. We're gonna do all the necessary care to determine if you need to be transferred out. So let's say that you get transferred to Kearney Regional to have surgery on that broken hip. Janelle or myself will more than likely be in contact with Kearney Regional, saying, hey, I saw so-and-so got shipped here for a broken hip, do they need swing bed services? Do they need to come back to our hospital before they can safely return home for physical therapy, occupational therapy, or speech therapy. Maybe even IV antibiotics. You need IV antibiotics for 6 weeks, every 6 hours or something. That's still something that qualifies under that swing bed service. Okay. So with that process, so traditional Medicare, well, regardless, traditional Medicare or Medicare Advantage, you have to have at least 3 inpatient midnights. Okay. So after your 3 inpatient midnights, then you can qualify for skilled nursing or swing bed services. So more than likely, the care managers have reached out to us, and we have your information. You're doing pretty well there at Kearney Regional after your surgery. You're walking about 10 feet, but you also have 5 stairs to get into your house, and you just can't quite do those yet. So as long as it's medically necessary that you need swing bed services, which I would say a broken hip is medically necessary. As long as we are able to provide care for you, our care team kind of determines that, we're going to get you back to our hospital. After those 3 inpatient midnights, we're going to try and get you back as soon as you are medically stable. So that could look like, day 4 or, maybe the following day. With these Advantage plans, so kind of same scenario, we're going to take your information, but we have to submit that to your Medicare Advantage plan. So say we have to submit that to your WellCare insurance in order for you to come back. So say it's a Thursday, we submit that. Well, Friday, we haven't heard back. So you're going to stay probably Saturday because WellCare is not open, more than likely on Saturdays. Sunday, they're not open. Monday, we could call and say, hey, what's the status? Well, it's still pending. Okay. So finally, Tuesday, we get the approval for you to come to our hospital. Usually they're going to grant you about 7 days. So let's say we get you there on Tuesday. Our care team is going to work with you, those 7 days, our therapists. And they may say, she can do about 3 stairs. But we still, she gets pretty tired after we do those couple stairs, and she does have 5 to get into her house. So the therapists are going to recommend that, you continue therapy services. So we're going to submit to your insurance again and basically beg for them to continue to approve you because we don't feel like it's medically safe for you to go home yet. So again, we're going to kind of wait. Usually they're a little bit faster this time. And they may approve you another 7 days, or they may say, no, I think she's good to go home. She can go home on home health services.
Or we've got home health doing all their prior authorizations that can delay. And that's one thing I take pride. I've been with our home health agency for 27 years as well as the system in general. We are so blessed here to have this agency. They usually come out the next day. And if they don't the next day, it's definitely within 48 hours of discharge. My mom, she lived up in Neely, Nebraska, Antelope County near Madison. She didn't even get a phone call from the home health agency for I don't even know, several days before they even called to set up a time for her. And my mom had traditional care. And I'm like, she had gold, liquid gold there. Why would you not call her sooner? And so we're very blessed to have our agency do that. And so if you were to go home on home health with just traditional Medicare, we're going to be there probably in 24 hours of discharge. If you're Medicare Advantage, you have to do all that authorization process like Miranda mentions, and it just delays everything so many more days.
And, if your insurance denies you an additional, days at our swing bed hospital, but we still feel like it's medically necessary, then we're kind of all scrambling. What do we do now? Do you have any loved ones that could come stay with you? What does this look like?
Can you afford private pay? Can you stay at our
I was gonna say, that was my question, is
Yep.
or you stay and you have to pay all of that out of pocket.
Exactly. Yep. And we've noticed in the last years, we've had challenging situations where we're at that point where we're delivering a non-knock is what we call them, which is notice of
non-Medicare coverage.
And that's nothing worse than coming, hey, Scott, sorry, your insurance is not working out, but it's gonna cost you $800 a day to stay for the next 3 days. That's terrible.
Has it ever happened where they haven't, let's say your day 7 is on a Friday and you reach out and they don't get back till Monday and they say that was denied, but that person has stayed in the hospital those extra 3 days.
Yeah,
So that's all then they have to pay out of their own pocket.
So my prior auth team were very good about that. Usually about day 6 or something, we're already reaching out to that insurance. We're kind of pests and we keep calling them, because of course we want that. But they do have to give a 48-hour notice. These Advantage plans, just like traditional Medicare, we have to give a 48-hour notice before you would go home. So if we ended up getting that, notice of non-Medicare that they aren't going to pay anymore on a Friday afternoon or something, they do have to give that 48-hour notice. So, great question.
It was just, as you were talking, like, man, what happens if they, on Monday, they say, nope, Friday was your last day, and then.
Yeah.
Oh, these are our cards. So for when you turn 65, this is the card you're gonna get. So those of you that don't take out Part B right away because you're still covered under your spouse or your own insurance, you'll have hospital Part A, and I'll tell you when it comes out. And then when you take Part B, then you'll get another card that states when you get your Part B. Over here are your Advantage plans, and you may get them in the mail. And the reason I say this is because we've done this talk now several times, and people bring all their cards to us, and they think they have Medicare and B and a supplemental, but then all of a sudden they have one of these cards. They're like, well, I never signed up for it. Again, these insurance companies are getting a lot of money kickback from this, and they're calling you all times, hours of the day. Right now, you're seeing all these advertisements on TV, so they're really sucking you in, sending you stuff in the mail. So if you pick up the phone and you're talking to somebody, you're like, yes, I would love some vision insurance as well. You basically just signed up. And so now they're sending you a card.
Really the trick to remember is if you want traditional Medicare, you have to call Social Security, or you have to go online to do it.
You'll get that 3 months prior to turning 65. And then you do not have to do anything else.
Except for your Plan G.
So that packet
And every
is
year.
from the Social Security Administration.
Yep. And every year you don't have to renew your traditional Medicare. You don't have to do anything.
No. Now,
So
those
somebody-
only exist because of Advantage plans, because they're finding out places are not accepting them, or even in this area, when I help somebody, they might only sell 4 plans in Dawson County. And then in Elwood, over in whatever, Gosford County, they may only sell 3 plans that are completely different from the 4 or 5 plans available here. And that's what makes it so challenging. But with that, you'll see here where it says Med-Ed, that's Medicare Advantage, Medicare Advantage. You'll see that on those up there as well. But yeah, that's where it's so confusing for people. And Medicare will never call you. Traditional Medicare, these folks right here, they're never gonna call you and ask you for anything. You're gonna get that packet in the mail, and you're gonna contact them or get online and sign up. That's it. It's the only time you'll have any kind of correspondence with them. These guys are relentless.
The thing I found when I'm trying to get hold of Medicare or anything, and you have to call these numbers, one's Lincoln, one's Omaha, and then they get you, it's an automatic deal with somebody comes on the line and talks, but you have to punch numbers. You can't get a regular person.
It's automated.
And it's very, very hard for me to get through to anyone. And a lot of times I follow their deal and they'll say, well, I didn't get that. And please do this or that again. And so I did that. But I'm still not getting anybody. They end up hanging up on me. It's very, very frustrating.
It is. I'm so sorry you're having to go through all of that.
I just hate it. I said, what's wrong with getting a person in there that you can explain what you need? They get you that person instead of going through this. Well, somehow it's not picking up what you're putting in your phone, it doesn't make sense.
Yeah. We've heard that a lot. Yeah, unfortunately.
Real quick, I just wanted to explain the prior authorization process for our hospital. So if you go see a provider at our clinic and they're ordering, a CT scan, a mammo, MRI, something like that, the nurse or the provider over there is going to put in that order. That order is going to get sent to our prior authorization team. with that, we're gonna, verify your insurance, make sure it's still active. And then, again, we're gonna make sure it's medically necessary. Traditional Medicare, you're probably gonna get we send it on to our scheduling department. You'll probably get a call within probably 24 hours, 48 hours, depending how fast the provider is able to get us your information, to go ahead and get on our schedule. This is for Advantage plans and for commercial plans. It's just a drawn out process. So up to those 15 days. I know a lot of people just have Blue Cross Blue Shield commercial plans. And I don't think what people realize is Blue Cross Blue Shield commercial plan, they again have up to 15 days, to authorize a CT scan or anything. So I think people think once we submit it to insurance, we can answer back right away. Sometimes we do, but other times it's just a process. So, and then again, once we have the approval, then we send that on to our scheduling department, and our scheduling department will be in contact with you to get on our schedule. I think that is it.
I do know that the Advantage plans, it's really hard to find a dentist that's in the Advantage plan at all.
Yep, it is.
And the specialist, because I have glaucoma and stuff, it is hard to find somebody that's in the plan with that.
And that's where these Advantage plans, I think, if you live in an urban setting, Omaha, Lincoln, those places, I think you have more opportunities to find places that accept these.
But I don't want to
plans.
live in no big city.
Right, well, even just for you to make an appointment for your eyes to go clear to Omaha, that's,
Right.
3 to 4 hours there, 3 to 4 hours back, maybe an overnight stay, someone to drive you if you have to have a procedure, you're dealing with your eyes, so you may not be able to see to come home.
Right.
So that's the thing, these Advantage plans, I truly think that they probably started out with great intentions, thinking it would be an easy one-stop shop, kind of an easy process, but it's just been a struggle for so many people to navigate. We just don't have those resources out here in rural Nebraska. It's really hard.
And there's some people, we've heard they love their Advantage plan.
Yeah.
They've been on it for a few years and they absolutely love it. And that's great. I just hope that whenever they need to actually use the Advantage plan, that, it helps them.
When I had Blue Cross Blue Shield, I never had any problems and that, but I went to this other and I really want to go back to Blue Cross Blue Shield.
Let's visit after this. Yeah, so that we can.
Well, ladies, thank you so
Yes,
much.
thank you.
You've given a lot of great information about both traditional Medicare as well as medical
Yeah.
advantage. What I hear you saying is really do your research.
Yes.
Talk to your doctors, talk to your specialists to see what they will accept. So you go into the remainder of this open process with the best information. So with that, I will end this